6:50 पे कर देना आप, ठीक है? हेलो, चलो guys, now welcome back. Now we are going to do the next part after tuning fork testing. Let us do the next discussion of pure tone audiometry, beta. The next audiology testing is pure tone audiometry. Now, what is pure tone audiometry? It's a subjective test of hearing in air conduction and bone conduction. Subjective test means subject is involved in the test, beta. It's both test, beta, air conduction and bone conduction. So we test in both the ways, air conduction also, bone conduction also. Subjective test means subject has to respond whether he or she is hearing or not, beta. Look at screen, everyone. When we do audiometry, please see on the screen, this is the audiometry setup, beta. Can you see the patient is telling you, oh, I can hear it, I cannot hear it. This is the audiologist doing the test. This is audiometry room and the patient is there and he's wearing the earphones and he's telling. Subjective test means subject has to tell you whether I'm hearing it or not, beta. Okay. Now look at the screen, beta. This is what, beta? This is of course the air conduction, beta. Air conduction. Can you see? Earphones give you air conduction, but this one will be bone conduction, beta. This will be of course bone conduction, beta. Am I clear, beta? Air conduction, bone conduction, beta. So can you see, beta? This is air conduction. Tuning, the earphones give you air conduction, but this mastered stimulator will give you bone conduction, beta. So it is subjective test of hearing in air conduction and bone conduction. Now, the second point, in this, what kind of frequencies we are testing, beta? It's tuning fork is which frequency, beta? What is the tuning fork frequency, beta? Look at me, beta. What is the tuning fork frequency? Is 512 hertz, beta. Tuning fork is only one frequency, 512 hertz, but here we test many frequency, beta. 250, they are in what? In hertz, beta. What is the unit of this is hertz, hertz, Hz. 250, 500, 1000, 2000, 4000, 6000, 8000. So please understand, when I say low frequency problem, 250, 500. When I say high frequency problem, 6000, 8000. So high frequency loss, low frequency loss. If a patient are not able to hear the 250 hertz, 500 hertz, you have got a low frequency hearing loss. If someone is not able to hear 6000 hertz, 8000 hertz frequency, it means high frequency hearing loss. Is it clear, beta? Now this is frequency. Now hearing level up to 25 decibel is normal, beta. Please understand, everything has normal in this life, beta. Like vision, look at me, beta. Vision, 6 by 6 is normal. From 6 meters, 6 lines being read is considered normal. Something has to be counted normal, beta. Now hearing up to what level is normal? Please understand, up to 25 decibel, the hearing is normal, beta. If you can hear sound up to 25 decibel, it's normal. 25 decibel sound, you should be able to hear it, beta. So like, you should be able to hear this sound, beta. Okay, that is 25 decibel sound. And if you are able to hear this sound, it means you are within the normal hearing zone, beta. Now this is what the audiogram look like, beta. That's an audiogram. Audiogram means the test report of the audiometry. What is the name of test, beta? The name of test is PTA, beta. Pure tone audiometry. Everybody was speaking about PTA is the most fundamental test of audiology, beta. This has to be done in any patient of hearing loss. If your relative has a hearing loss, which test would you write? PTA. What is PTA? Pure tone audiometry. Audiometry means a hearing test, beta. And the report of that is called audiogram, beta. And we get the audiogram in the form of a graph like this, and this is the audiogram, beta. So please see. Now please see, this side is 0, 10, 20, 30, 100 decibel, beta. This is decibel, beta. And this side is frequency, beta. This is frequency. Okay, can you see 0, 10, 20, 25. Up to 25 is normal, beta. If your hearing line are coming in this zone, you are normal hearing person, beta. But if your hearing line are coming in this zone, you have got a hearing loss, beta. If somebody's hearing is coming in this zone, you have a hearing loss, beta. Very simple interpretation. Your hearing lines, your test report should come, your testing line should be coming in this zone, beta. If it is between 0 and 25, it's normal. 0, 10, 20, 25. Up to 25 is normal, beta. Guys, in this test, more towards 0 you are, better you are, beta. Please see, beta. Please see, beta. More towards 0 you are, better you are, beta. Let me show you. Whatever, you are hearing, please see. Can you see, beta, over here? Now, please see. Can you see over here, beta? This is 0, 10, 20, 25, beta. 25. Can you see what 25 beta? Please understand. If your hearing is coming in this zone beta, if your hearing is coming in this zone, you have a normal hearing beta. But if your hearing is coming below that, in this zone, mild loss, this zone, moderate loss, more low, severe loss. And even in this zone, if you come, you have got a profound hearing loss beta, profound hearing loss. I think it should be easy for anyone to understand. In any audiogram, you know, more towards zero you are, better hearing you have. Better hearing you have. Don't think otherwise, beta. More towards zero you are. If your hearing lines are here, you have got a very good hearing, beta. Up to 25, if your lines are coming, you are absolutely normal. But if your hearing lines are coming in this zone, then mild loss. This zone, moderate loss. This zone, severe loss. Then this zone, profound loss, beta. So, in audiometry, more towards zero you are, better hearing you have, beta. Don't score 100 out of 100 in this patient, beta. Don't score 100 out of 100 and feel very good. Oh, मेरे तो 100 number आए, मेरे तो 100 है score. Don't score 100 out of. In this, if you're scoring 100, you means you are deaf. You are deaf. It's not a good thing. It's not a good thing. More towards zero you are, better hearing you have, beta. Okay, fine. Now, let's go further, beta. Now, please see. Symbols used in audiogram, beta. The A conduction symbol, bone conduction symbol, beta. So, whenever we have audiogram, we have two types of symbol for air conduction, bone conduction, beta. Air conduction, bone conduction, beta. Okay. So, circle, triangle, square, cross are air conduction. Very simple, beta. BC, B means brackets, beta. These kind of brackets, B means bracket. Any brackets, beta, brackets, open mouth brackets, beta. So bone conduction like look like brackets, beta, bracket. So bracket like symbols are of bone conduction, but the circle, triangle, square, cross is air conduction symbol, beta. Now right now on the side, circle is right ear air conduction. Circle is right ear air conduction, beta. Circle is right ear air conduction. One question, beta. They can ask you circle. Oh, circle is air conduction. But which ear? Right ear, beta. Okay, fine. Now, interpretation of audiogram, beta. Everybody, please see. Normal people. Very simple. Both AC and BC are within 25 decibel range. I told you, up to 25 decibel, your both lines should come. AC, BC line, and then you have got normal hearing, beta. Okay. So, normal is both AC and BC are up to 25 decibel, beta. But look at the, now everybody try with me, beta. Conductive hearing loss, beta. Please apply the tuning fork test knowledge, beta. Conductive hearing loss. What is poor, beta? In conductive hearing loss, is AC poor or BC poor, beta? Socho. Conductive hearing loss, tuning fork test se yaad karo, beta. Tuning fork test mein, conductive hearing loss mein, AC was poor or BC was poor? You remember, you know, in conductive hearing loss, BC is better than AC. It's called Rene negative, beta. Rene negative. Try to recall tuning fork. Rene negative is CHL. What is Rene negative? BC is better than AC. So, in conductive hearing loss, AC is poor, but BC is normal, beta. And there is AB gap. AB gap also. AB gap is the hallmark of conductive hearing loss. AB gap means conductive hearing loss, beta. Can you write down, beta? Yeah, write down, beta. AB gap. Whenever you see AB gap means CHL, beta. People who remember this line, it may pay you in the exam, beta. If there is a gap between two lines, 100% conductive hearing loss, beta. AB gap means conductive hearing loss, beta. AB gap means conductive hearing loss, beta. Okay. Now, SNHL. Now, everybody SNHL, beta. Now, think with me, beta. Now, you're very easy, beta. Everybody think with me. SNHL. Look at me, beta. SNHL, what is weak? Cochlea is weak. SNHL, cochlea is weak, beta. Now, look at me. If cochlea is weak, you go through air conduction or you go through bone conduction, both will be weak. Because air conduction goes where? Cochlea. Bone conduction goes where? Cochlea. In SNHL, cochlea is weak. So in SNHL, you go this way or you go this way, both will be poor. Because AC or BC, both sound eventually go to the cochlea only, beta. Okay? See, in SNHL, both AC and BC are poor, beta. Poor means below 25. In conductive loss, BC will be normal, AC will be poor, beta. AB gap, beta. Okay? Now let me show you the three audiogram, beta. Can you see, beta, this is normal audiogram. Where is 0, 10, 20, 25, beta. This is 25. This is the normal hearing zone, beta. Okay, so up to this zone is normal beta. Okay, so this is normal. In normal audiogram, AC, BC both are in the normal range beta. Okay, but this one please see. Okay, what is this line beta? BC. Why? BC is brackets beta. Brackets beta. BC bracket. है ना? BC is normal. AC is poor. BC is normal, AC is poor. है ना? Below 25 ना? Can you see beta? 0, 10, 25 beta. This is normal zone na? BC is in the normal zone, but AC is poor beta. And this gap is called A, B gap. Beta, label it properly. Conductive hearing loss, BC is normal, poor. AC is poor. Poor means below 25. If your line is below 25, it is poor. Poor means kharab. BC is normal, AC is poor, and this is AB gap. I told you AB gap means conductive hearing loss. If there is AB gap, it means conductive hearing loss. Conductive hearing loss. And third one, SNHL. SNHL beta, both AC, BC poor. In SNHL, both AC, BC poor beta. Poor means both are below 25 beta. Of course, it is visible. Both are below 25 beta. In SNHL, both AC, BC are poor. It's not that rocket science beta. Audiometry is very simple. If there is AB gap, it is CHL. Both poor is SNHL. Once again beta, AB gap, conductive hearing loss. Both AC, BC poor, SNHL beta. Beta. Once again beta, in conductive hearing loss, there is AB gap. If there is AB gap, I will mark conductive hearing loss. And if both AC, BC are poor, I will mark SNHL beta. It's not that difficult beta, honestly. Okay. So audiometry, what to remember? If there is AB gap, then you mark conductive hearing loss. If both AC, BC are poor, you mark SNHL beta. Chalo. Let us go further beta. Now, two special dips in audiogram. Two special dips in audiogram beta. Audiogram is PTA. Two special dips. Now, what are two special dips? Just dip at 2000 Hz in BC. It is seen in otosclerosis and it is called Carhart's notch. Carhart's notch beta. Okay. Now, look at the first one. Next one beta. Just come over here beta. Let us see this one beta. Otosclerosis, there will be conductive hearing loss and conductive hearing loss will be AB gap. AB gap beta. Okay. And there is Carhart's notch. Carhart's notch is dip at 2000 Hz in BC. Carhart's notch is dip at 2000 Hz in BC beta. Everybody mark it like this. This is the Carhart's notch beta. Can you see the upper line of BC beta? Can you see the upper line of BC? And in the bone conduction curve at 2000 Hz there is a dip. 2000 Hz in dip. Dip at 2000 Hz in BC is called Carhart's notch. Is a star question of your exam beta. Carhart's notch beta. Carhart's notch, otosclerosis. Otosclerosis anyway is a very important topic beta. Okay. Carhart's notch is dip at 2000 Hz in BC beta. Okay. Now, SNHL, the noise-induced hearing loss beta. Noise-induced hearing loss, noise will damage your cochlea. It will cause SNHL beta. Okay. And there will be dip, there will be this something called acoustic dip. What is acoustic dip? It is dip at 4000 Hz in ACBC. Dip at 4000 Hz in ACBC beta. In ACBC. Okay. This is the Carhart. This is the acoustic dip beta. Can you see beta? There is a dip at 4000 Hz in ACBC beta. This one. Am I clear beta? Fine. Dip at 4000 Hz in ACBC. This is called acoustic dip beta. Two special dips in audiometry beta. Let us devise them beta. Two special dips in audiometry. One dip in otosclerosis, other dip in noise-induced hearing loss. First of all, otosclerosis will have conductive hearing loss, matlab AB gap. Everybody, please understand, this is BC line, this is AC line, this gap is called AB gap. You can see the upper line is BC line, lower line is AC line, and there's a gap. Gap means AB gap. AB gap means conductive hearing loss, beta. AB gap means conductive hearing loss. And there is a special dip in audiometry called Carhart's notch in otosclerosis, and Carhart's notch is a dip at 2000 Hertz in BC, beta. Okay, the second one is noise-induced hearing loss. It has got SNHL and it has got acoustic dip, and this is a dip at 4000 Hertz in AC and BC. Okay, beta, fine, beta. याद रहेगा beta. So two dips, beta. एक बार फिर से रिवाइज करते हैं. There are two dips in audiometry. One dip in otosclerosis. Otosclerosis got Carhart's notch. Carhart's notch is dip at 2000 Hertz in BC, beta. Okay. Now number two is noise-induced hearing loss. It has got acoustic dip. It is dip at 4000 Hertz in AC, BC, beta. This one, beta. That's all. याद है बेटा. एक बार फिर से बोलो मेरे साथ. Carhart's notch is dip at 2000 Hertz in BC. It's a feature of otosclerosis. Acoustic dip is a dip at 4000 Hertz in AC, BC, and this is a feature of noise-induced hearing loss. Okay, beta. Chal. Now, two special audiograms, beta. Meniere's versus presbyacusis. Meniere's causes SNHL. What is presbyacusis? Presbyacusis is presbyacusis, beta. A is missing, beta. Write down the A. Presbyacusis, A. Write down spelling it, beta. Once again, presbyacusis. Presbyacusis, beta. Presbyacusis. Have you heard the word presbyopia, beta? You know presbyopia, age-related vision problem. Presbyacusis is age-related hearing loss, beta. Pres माने age-related. Presbyacusis is age-related hearing loss, beta. Both are what? SNHL. Now, Meniere's is unilateral disease, beta. Highlight the word unilateral, beta. Unilateral disease, beta. Next time we'll do the, we'll have one more session of ear of 2 hours little later, because I know today you have got the surgery also. I talked to them, but I think surgery is also planned. So we'll have 2 hour, session for diseases. There are 4 important topics we'll do later on, beta. We'll do that. Don't worry about it. Leave it to me. We'll do it maybe on, I think, one of these days, coming days only, beta. Don't worry. Okay. So let us do this one understanding properly. Meniere's involve 1 year. Age will involve both years, beta. I think that's logical. Age is going to cause damage in both the years, beta. Okay. Now, Meniere's causes low frequency SNHL. Meniere's causes low frequency SNHL. Therefore, it shows rising audiogram, beta. Rising audiogram. Rising audiogram, beta. Therefore, it shows rising audiogram. Presbyacusis causes high frequency SNHL. Therefore, it shows sloping audiogram, beta. Sloping audiogram. Rising audiogram, sloping audiogram. All of you just draw on the side, beta, like this, beta. Rising audiogram like this. Rising audiogram just draw like this, beta. And sloping is like this, beta. Like on this. Rising, this is rising, beta. Rising is like this one, beta. Can you see rising audiogram, beta? Rising audiogram. This rising audiogram, and you make this side sloping audiogram like this, beta. Rising audiogram, sloping audiogram, beta. Two special audiograms, one in Meniere's, other in the presbyacusis, beta. One Meniere's, other presbyacusis, beta. First of all, let's revise. Meniere's is SNHL. Presbyacusis is also SNHL. Presbyacusis is age-related hearing loss. Age will damage your cochlea. Of course, it will cause SNHL, beta. Now, Meniere's involve 1 year. Presbyacusis involve both years. One difference is Meniere's causes low frequency SNHL, therefore rising audiogram, and presbyacusis causes high frequency SNHL, therefore sloping audiogram. How to remember? Age slopes you down, beta. Age slopes you down, na? Age is sloping down. Age is sloping down, beta. Yaad rakhna hai? Age is sloping down. Okay? Age is sloping down, beta. Am I clear, beta? Fine. Chalo. Let us do the next test now. Bera, everybody. Let us do the next test now. Brainstem evoked response audiometry. Brainstem evoked response audiometry, beta. How to really see, beta? Go back, beta. Go back, everybody. Put a number, beta, of the test so that you know what you're doing, beta. Number 1 test was tuning fork test, beta. Number 1 test was tuning fork test. Number 1. Number 2 test was on the page number 121, pure tone audiometry. Number 1 test is tuning fork test. Number 2 test is pure tone audiometry. All these are pure tone audiometry discussions, beta. Okay, 2 special dips audiometry, 2 special audiogram audiometry, and now come number 3, beta. Number 3 is brainstem evoked response audiometry. Everybody say the full form of BERA, beta. Say full form BERA. BERA, brainstem evoked response audiometry. BERA is objective test of hearing, beta. Objective. Can you see? It is not subjective. The subject is sleeping comfortably. Subject is not telling you, oh, I am hearing, I am not hearing. Can you do pure tone audiometry in this child, beta? Pure tone audiometry was subjective test. Do you remember? That patient was telling you, I am hearing or not, beta. I hope you remember. Pure tone audiometry was subjective test. Can you subjective test, beta? Patient is telling you, I am hearing, I am not hearing. You are making report accordingly. Can 6-month-old baby tell you, Doctor, Dhavan, I am hearing it. No, I am not hearing it. 6-month-old baby can sleep only, that's all. For children, this test is useless, beta. Okay, for that we need a test which is objective test, means where the subject is not involved. Okay, BERA is a test which is objective test of hearing, beta. Objective test of hearing. Okay, now look at the principle, beta. Please see on the screen. How we do it? Very simple. It's EEG, beta. Very simple meaning, beta. Please see. We are putting the earphone in the baby's ear, beta. Okay, we give sound to the ear, and then we have put the electrode on the forehead for the brain, beta. We give sound to the ear and we record the electrical activity from the auditory pathway, beta, and that goes to the computer, beta. Okay, brainstem evoked response audiometry means you are evoking a response. You are giving a sound to the ear and you are evoking an electrical activity in the brain, and you are recording that activity, and that laptop shows this activity. It means your child is hearing normally, beta. Now read, beta. Read, everybody. We stimulate the ear with the sound and record electrical activity from auditory pathway. Please read the principle, beta. Principle is we stimulate the ear with sound and we record electrical activity from auditory pathway. Do you remember auditory pathway lies where? It mainly lies in the brainstem area. That is why I put an arrow. That is why BERA, B-E-R-A, beta, BERA. Why B, beta? What is B? Brainstem, beta. Highlight. Try to understand why these things are like that. BERA. Why BERA? Brainstem. Because auditory pathway mainly lies in the brainstem area. BERA has 7 waves. 1 to 7, beta. And the most important wave of BERA is wave 5, beta. Wave number 5. MCQ. Most important wave of BERA is wave 5, beta. Everybody draw, beta, here. All of you draw 1, 2, 3, 4, 5, 6, 7, beta. This is wave 5, beta. Everybody please draw one more time. BERA has got 7 waves. The most important wave of BERA is wave 5, and it is produced by lateral lemniscus, beta. Most important wave of BERA is wave 5. It is produced by lateral lemniscus, beta. I hope you remember right now, beta. Lateral lemniscus, yaad hai? E ko lai ma. Remember L, beta? Remember L? L mane lateral lemniscus, beta. This gives wave 5, beta. ऐसे लिख लो बेटा तो याद रहेगा बेटा. दोनों क्वेश्चन कवर हो गए अपने. E. coli ma, what is L? Lateral lemniscus gives which wave? Wave 5. Wave 5 is the most important wave, beta. Wave 5 is the most important wave in BERA. Am I clear, beta? Fine. Now, uses of BERA, beta. Use of BERA. Use of BERA. Pediatric patients, of course, children, and people who lie, beta. People who try to confuse you, beta. What is MLC? Medico-legal cases. In medico-legal cases, you want to be sure whether patient is telling you correctly or not. So, pediatric patients or malingering, beta. Malingerers, what is malingerer? Malingerer means people who are trying to lie, beta. MLC, what is MLC? Medico-legal cases. Okay, beta. Let us revise once again. What is the name of this test? BERA. What is full form BERA, beta? Brainstem evoked response audiometry. We give sound to the ear and we record electrical activity from auditory pathway which mainly lies in the brainstem area. That's why B for brainstem beta. It has 7 waves, but the most important wave of the bara is wave 5, and it is produced by lateral lemniscus. It's mainly done in children or for medico-legal cases beta. Now the fourth test beta, auto-acoustic emission. It's a very small machine, handheld machine. Auto-acoustic emission. Emission means echoes beta. Echoes. Okay. Principle. We give sound to ear. We give sound to ear beta. We give sound to ear and then we record echoes. Echoes from outer hair cells of cochlea. Outer hair cells of cochlea. That's the MCQ beta. Outer hair cell is the MCQ. Echoes are produced by which cells of cochlea? Outer hair cell. I hope you remember the cochlea has got outer hair cell and inner hair cell beta. So when you give sound to the cochlea or sound to the ear, the cochlea sends you echoes back beta. And those echoes are produced by outer hair cells of cochlea. These echoes are called OAE beta. Auto-acoustic emission. Auto-acoustic emission. Very simple test beta. If echoes are recorded, it means cochlea is working normally beta. Please see on the screen beta. Very simple test beta. It's a handheld machine beta. You put a probe in the ear of the child, newborn baby. You give sound to the ear, and if echoes come back, this machine will show echoes here. It means cochlea is working normally. Very simple test, very quick test. Even ward boys can do. No technical input required. Anybody can do beta. Okay. Once again, what is full form of OAE? Bolo beta OAE full form. Auto-acoustic emission. What is emission? Echoes. What is the principle? We give sound to the ear and we record echoes from outer hair cells of cochlea. These echoes are called auto-acoustic emission. If echoes are recorded here, it means this child cochlea is working normally. It's a simple test, very basic kind of test beta. Okay, chalo. Now advanced question beta. MCQ beta, PG question beta. Ideal hearing screening investigation in newborn baby. If the question says newborn baby, OAE. Newborn baby matlab you don't have any doubt, but you just want to find out casually beta. OAE. But if the question says meningitis baby or NICU baby, what is NICU? Neonatal ICU baby, means high risk baby, then you mark bara beta. Please attempt this question carefully. This question is very popular in PG beta. If he says that ideal hearing screening investigation for newborn babies, just newborn baby, normal newborn babies, well babies, then you do a simple test called auto-acoustic emission. But if the question tries to tell you that there's a high risk baby, like a meningitis baby, I hope you remember meningitis can lead to deafness. I hope you remember meningitis can lead to deafness. So meningitis baby is a high risk baby. Then you please mark bara beta. Okay. For a normal neonate, OA is a sufficient test. But for a high risk baby, bara is a good test beta. Am I clear beta? Fine. This is a PG level question, need PG question. But you never know. This is expected from all undergrads. They should know that if it's a normal newborn, you will go OE. If it's high risk newborn, you go for bara beta. Okay, chalo. Now, tympanometry. Tympanometry, first of all, the fifth, this is the fifth test beta. We're doing audiology, fifth test beta. Tympanometry, also called impedance audiometry. Tympanometry, also called impedance audiometry. Tympanometry, also called as impedance audiometry beta. Impedance audiometry. Okay. Now, this is tympanometer beta. This tympanometer. What is the function of this test beta? This records freedom. This test records freedom of movement on change of EAC pressure. Just cut this beta. You can cut this. This test records freedom of movement of TM and ossicle. Itna sufficient hai beta. this is sufficient beta. This test record freedom of movement of tympanic membrane ossicles beta. How much freedom is there to move beta? I told you TM and ossicle, tympanic membrane ossicle are one unit. They move together. How much system is elastic to work? How much system is free to move? System में कितना लचक है? System में how much elastic system is beta? When sound energy comes or the pressure of the air comes, how much it can move beta? When you do seagulization, you put air pressure and the tympanic membrane moves beta. This test checks how much air pressure, how much movement happened. Very simple beta. Seagulization is a crude method. Na? What is seagulization? Putting air pressure on tympanic membrane. When you put air pressure on tympanic membrane membrane ossicle moves beta. Okay? They move now. But this is a sophisticated seagulization beta. It says this much pressure given, how much movement happened beta. And the machine records the freedom of movement of tympanic membrane ossicles, and by recording that, it makes the curves on the screen beta. This is the curve beta. Can you see beta? This is the screen beta. On this screen, we get different type of curves beta. There are 5 type of curves and 5 type of diagnosis. Okay? Now, see beta? Write down. There are, just add one line beta. There are 5 type of curves shown. There are 5 type of curves shown beta. There are 5 type of curves shown beta. Type A, normal. Can you see beta? Label type A, normal. Type B is flat curve seen in glue ear. Glue ear also called as serous otitis media. Very popular question. Type B curve is the most commonly asked question beta. Type B curve is flat curve, no movement, glue ear. It is seen in glue ear beta. Everybody, think logically beta. Think logically. If your middle ear is full of glue, remember glue? Fevicol like glue? If the middle ear is full of glue beta, would that glue allow any freedom of movement in your system? No. Flat curve, no movement. It's a logical thing. If your middle is full of glue, you remember that video beta? Fevicol like glue beta. Will that thick glue allow any kind of movement in your system? No. So type B curve is seen in glue ear or serous otitis media. It's a flat curve beta. This you should not forget beta, flat curve. Type C curve, eustachian tube dysfunction. AS curve is another question beta. Type AS curve is seen in otosclerosis beta. Otosclerosis. AS curve is seen in otosclerosis. S1 is sclerosis. Otosclerosis. AD, D mane, AD, seen in ossicular dislocation beta. D mane dislocation. D mane dislocation beta. Okay, bache, fine. Fine beta. Glue ear. Please see glue ear. Write down यहाँ पे flat लिख लो beta. Flat. Highlight glue ear is very important beta. Flat curve, type B curve. Flat. Write down here flat. Can you see flat? A is a beautiful bell-like curve beta. Let us revise this beta. What is the name of this test? The name of test is tympanometry, also called impedance audiometry. What is this test checking? It's a better test than seagulization. Seagulization was putting air pressure and there is a movement of tympanic membrane ossicles. This is going to record this much pressure put on the tympanic membrane, this much movement happen, and the machine can record the freedom of movement of tympanic membrane ossicle. By recording that freedom of movement, it makes some curves on its screen. There are 5 type of curves and 5 diagnoses. Let us revise beta. Type A curve is seen in. Type A curve is seen in normal people. Type B curve or the flat curve is seen in glue ear, also called as serous otitis media. Type C curve is seen in eustachian tube dysfunction. AS curve is seen in otosclerosis. S1 is sclerosis. AD mane ossicular dislocation. Ossicular dislocation beta. Once again, let us revise beta. Type A curve is seen in normal people. Type B curve is seen in glue ear or serous otitis media, and type B curve is a flat curve. Nobody will forget type B curve beta. Type B curve is flat curve. It is seen in glue ear or serous otitis media. Please don't forget, glue ear is nowadays labeled as serous otitis media. Beta. एक ही बात है, one and same thing. Glue ear and serous otitis media is same thing. Type C curve is seen in eustachian tube dysfunction. AS, S1 is sclerosis, AS curve, otosclerosis, AD curve, ossicular dislocation. Okay. Now, let's go further, beta. This was the 5th test, beta. Now we come to the 6th test, beta. 6th test. We're doing audiology test, beta. 6th test, beta. Stapedial reflex. Stapedial reflex. Stapedial reflex. Okay. Look at principle. On hearing loud sound. On hearing loud sound. What is the nerve for sound? Hearing sound? 8th nerve. Stapedius muscle contracts. What is the nerve supply of the stapedius? 7th nerve. Why it contract? To pull the stapes out of the oval window so as to protect the inner ear from damage to loud sound. From damage to the due to the loud sound. Look at me, beta. Look at me. Anybody who can tell me what is the function of stapes? It works like a piston. Remember, it works like a piston, beta. Piston. Now you are inner ear, beta. You are inner ear. One second, beta. ये कैसे देखना इसको okay sorry now imagine look at me everyone, you are the inner ear, okay, my hand is stapes. I hope you remember how does the stapes works. Stapes acts like what? Piston beta. You are inner ear, beta. Stapes acts like piston. You are inner ear. Now loud sound comes, piston moves like too much. This can destroy the inner ear in subsequent years, beta. Inner ear has been protected by nature. How? When you hear the loud sound, first time you have to hear it. When you hear the loud sound, look at me, beta. You are inner ear. Stapedius muscle contracts and it pulls the stapes out of the oval window a little bit, so that whole of the sound energy is not passed on to the inner ear, so that inner ear is protected. Again, read it. On hearing loud sound, stapedius muscle contracts to pull the stapes out of oval window so as to protect inner ear from damage due to loud sound. Okay, beta, fine. Inner ear is the MCQ, beta. Stapedial reflex protect which part of ear? Inner ear, not middle ear. It's a reflex in the middle ear, but it is a reflex is for the protection of inner ear, beta. Okay, fine. Afferent of this reflex is, you know, afferent, efferent, you know, reflex. You saw a gulab jamun. You saw a gulab jamun and your mouth started watering. Seeing the gulab jamun is the stimulus. Watering is the response. So first the message has to go inside, sensory, afferent. Then the response has to come, efferent. Okay. Afferent is sunna, hearing, on hearing loud sound. Afferent is 8th nerve, beta. Efferent is 7th nerve. I hope you remember, stapedius is supplied by facial nerve. Nobody will forget it. Stapedius is supplied by facial nerve. Facial nerve, beta. Okay. Am I clear, beta? Stapedius is supplied by facial nerve, beta. On hearing loud sound, stapedius contract. Simple baat, beta. On hearing loud sound, stapedius contract. तेज आवाज सुनने पे stapedius contract कर जाती है to protect your inner ear, beta. Okay. Now this reflex is absent in deaf patients. 8th nerve gone, beta. Reflex only comes when the both nerves are intact, beta. Afferent nerve, efferent nerve should be intact. Only then the reflex will come. Deaf patient, beta. बeta. On hearing loud sound, तेज आवाज सुनने पे, पहले सुन तो लो. First you have to hear it. First you have to hear it to generate the reflex, beta. Deaf patient cannot hear any sound, beta. How can they generate the reflex? Bell's palsy, facial nerve palsy, seventh nerve gone, beta. I told you, the reflex only comes when both nerves are intact. Okay, fine, beta. And third one is otosclerosis fixed stapes, beta. I hope everybody knows stapes is fixed, beta. When stapes is fixed, how can it come out, beta? When stapes is fixed, how can it come out? Okay, fine, beta, fine, wonderful. Okay. Let us revise this, beta. Stapedial reflex, the sixth test. On reflex, one stimulus, one response. On hearing loud sound, stapedius contracts. To protect inner ear, MCQ, inner ear protection. Highlight the word inner ear, beta. On the sidebar, keep writing the important point. To protect inner ear, okay? Afferent of the reflex is 8th nerve. Efferent is 7th nerve, because I am very sure stapedius muscle is supplied by facial nerve. The reflex is absent in number 1, deaf patients, 8th nerve gone. Bell's palsy, facial nerve, 7th nerve gone. And otosclerosis, fixed stapes. If stapes is fixed, how can it come out of the oval window now? Okay, that's the sixth test, beta. This is the end of the audiology, beta. This is the end of the audiology also here, beta. End of the audiology also here, beta. Am I clear, beta? Fine. Now, let us do the next topic. Temporal bone fractures. Temporal bone fracture, beta. Everybody, temporal bone fracture. Can you see, beta? Temporal bone fracture, beta. Can you see? Can you see this temporal bone? There are fractures like that. Okay, first of all, in this fracture, we see battle sign. If you know, this question was there last time also. One time already. It is a repeat question, beta. Battle sign. What is battle sign, beta? Look at the screen, beta. Can you see on the mastoid area, there is ecchymosis. What is ecchymosis? Blue color, beta. Remember yesterday was the ecchymosis, beta. Write down. Write down. Battle sign. It is ecchymosis in the mastoid region, beta. Please mark it. This is the battle sign, beta. Always label it, beta. Oh, always try to make your things very. Oh, ecchymosis means blue color, beta. It is seen in skull base fracture, particularly temporal bone fractures, beta. I hope you know, beta. Temporal bone is the base of skull, beta. Look at me. Temporal bone makes the part of skull base. So battle sign is a feature of skull base fracture or temporal bone fracture, beta. Okay. This can be VQ mane visual question, beta. Don't forget, beta. Ecchymosis on the mastoid area is battle sign, and this can be a visual question also. The blue color on the mastoid. Anybody? Mastoid is a part of which bone? Temporal bone. What is this fracture, beta? Temporal bone fracture. Okay. Now, you have to now tell me something, beta. Everybody, focus on the screen and try to guide me that what is going to happen over here, beta. Now, anybody will tell me which nerve passes through the ear and comes out like this, beta? Which nerve, beta? Which nerve comes out of the ear? Passing through the ear, comes out. Facial nerve. Facial nerve. Everybody, please see on the screen, beta. Now, there are two types of fracture, beta. Please see. One fracture passes like this. This is number 1 fracture. And one fracture passes like very close to the nerve. The number 2 fracture, beta. 1 and 2. Write in the chat box or in the telegram. Which fracture will cause immediate facial nerve palsy? Fracture number 1 or fracture number 2? I'm asking, there are two types of fracture I'm showing you. Fracture number 1, fracture number 2, beta. You have to tell by common sense, which you are having abundant, beta, that you have to tell me which fracture will cause immediate facial palsy. Will be what fracture? Yes, fracture number 1, because it is cutting the nerve through and through. Fracture 2 will be causing delayed onset facial palsy. Why? Because facial nerve has not been cut, but within few days, what will happen? There will be edema around the nerve in this area, and that edema will press the nerve, beta. This edema. Okay, this edema will press the nerve. Fracture 2 will be causing delayed onset, beta. So this will be delayed onset facial palsy. This will be immediate onset facial palsy, beta. Am I clear, beta? Fine. Is it clear, beta? So fracture number 1 will cause immediate facial palsy. Fracture number 2 will cause a delayed onset facial palsy because it is due to edema, and edema will take some time. In this, fracture has not cut the nerve. Fracture has passed very close to the nerve, and that fracture is causing edema of the nerve, which will take 2-3 days to manifest, beta. Okay. Now look at your notes, everyone. Please see. Facial palsy in temporal bone fracture is of two types. Delayed onset, immediate onset. Delayed onset is due to edema of the nerve. Treatment is oral steroids. Beta. MCQ beta. Oral steroids. Edema, na? After 2 days, facial palsy started. Edema, treatment is oral steroids. Beta. Immediate onset is, it is due to direct injury to nerve by fracture line. The fracture has cut the nerve. Beta. It is due to direct injury to the nerve by fracture line. Treatment is immediate surgery. When nerve has been cut, why to wait? If it has been cut, it has been cut. Beta. Then you have to really, immediately suture it. Beta. Immediate surgery. Beta. So MCQ. Beta. Both are MCQ. Delayed onset needs steroid. Immediate onset need immediate surgery. Very simple question to answer. Very simple to remember also. Immediate onset need immediate surgery. Delayed onset is due to edema, needs steroid. Beta. I repeat, beta. Immediate onset would need immediate surgery. Delayed onset would need steroid because that is due to edema of the nerve. Beta. Okay. Now, next. Ossicular dislocation and conductive hearing loss. Beta. Okay, beta. Put an just on the side. Trauma can lead to ossicular dislocation. Trauma can lead to ossicular dislocation and conductive hearing loss. Beta. Look at me, beta. Look at me. Somebody had an accident, fell down, and the ossicle got dislocated. Somebody had some sort of accident of fall or something happened that people fell down like that. Some accident happened, beta. Somebody fell down from the motorcycle. The head hit the ground. Okay, the ossicle may get dislocated. The fractures can happen. Tympanic membrane can perforate. Because of trauma. So now this trauma can lead to ossicular dislocation, and that can be of two types. Now look at the screen. Look at your notes. There can be two possibilities in ossicular dislocation leading to conductive hearing loss. Two possibilities. Write down A and B, beta. A and B. Two possibilities. Write down A and B to make it more clear, beta. A and B. Ossicular dislocation with the normal tympanic membrane. Tympanic membrane word is missing, beta. With normal tympanic membrane word is missing. Membrane. It causes 54 decibel CHL. But the second thing is ossicular dislocation with perforated tympanic membrane. Perforated. The hearing loss is 38 decibel. Now this is very surprising. Beta. You may be thinking that ossicular dislocation with the normal tympanic membrane is less injury to the patient. But ossicular dislocation with perforation of tympanic membrane is more injury to the patient. But hearing loss is reverse. Beta. Ossicular dislocation with normal tympanic membrane is a very bad condition to suffer. Why? Ossicle are useless now. Now how the sound energy would reach the inner ear, beta? Ossicle, malleus incus got dislocated. They fell down in the middle ear. Now stapes is there. How can the sound energy reach the stapes now? That's why a lot of hearing loss, beta. But if there is a perforation with ossicular dislocation, please see, ossicle useless, ossicle useless. Both ossicle are useless now. This perforation will be giving advantage. Write down. Just make a diagram like that. Through the perforation, sound energy will enter the middle ear, beta. So perforation give you advantage. Why? Ossicle are useless. At least through the perforation, some sound energy directly enters the middle ear and gives you some stimulation of the inner ear because it directly pushes the stapes as a piston, and that gives you some advantage. That's why hearing loss is lesser in this case. In this case, it's 38 decibel, beta. Now, these both are MCQs, beta. Both are question, beta. These both are question, beta. Am I clear, beta? Okay, fine. Is it clear, beta? Fine. Okay. Once again, let's revise, beta. Trauma can lead to ossicular dislocation, and that can cause conductive hearing loss. Now, this ossicular dislocation means malleus incus got separated and they fall down in the middle ear. Now, this ossicular dislocation can be of two types. With tympanic membrane normal or with tympanic membrane perforation. Now, A is ossicular dislocation with a normal tympanic membrane. Surprisingly, this gives more hearing loss, 54 decibel conductive hearing loss. But the other situation, when the injury is more in fact, ossicular dislocation with the perforated tympanic membrane, hearing loss is lesser. Hearing loss is 38 decibel conductive hearing loss. Why? Ossicular useless in both situations. Through this perforation, at least some sound energy will be able to directly enter into the middle ear and stimulate the inner ear better. So that gives you advantage. So that's why on the side write down 54, 38. Don't highlight one 54, 38 beta. Yaad rakhna. 54, 38 beta. Okay, bache. Now, general points to remember. Okay. Conductive hearing loss due to wax. Wax, 30 decibel beta. Wax causes 30 decibel conductive hearing loss beta. And glue ear, 10 to 40. Glue ear, 10 to 40 decibel conductive hearing loss beta. Wax causes 30 decibel, glue ear 10 to 40. Wax causes 30 decibel, glue ear causes 10 to 40 decibel conductive hearing loss beta. Am I clear, bache? Fine. Once again, let us revise beta. Ossicular dislocation with the normal tympanic membrane causes 54 decibel conductive hearing loss. Ossicular dislocation with perforated tympanic membrane, 38 decibel conductive hearing loss. Wax can cause 30 decibel conductive hearing loss. Glue ear, 10 to 40 decibel conductive hearing loss. These four are factual questions. Okay, fine. Now, let's go to the next page. Noise-induced hearing loss. You know, noise-induced hearing loss is, put a line, beta. This is occupational disease, beta. It's occupational disease. Of course, some industry have a lot of noise, beta. What is the permissible level of noise in industry? Is 85 decibel, 8 hours a day, 5 days a week, beta. Permissible level of noise industry is 85 decibel, 8 hours a day or 5 days a week. If 85 decibel is not given the choice, then you mark 90 decibel. There are two MCQs possible because they may give the choice of 85. If 85 is not mentioned in the choice, then the second best answer will be 90 decibel. I hope you remember, in noise-induced hearing loss, we see acoustic dip, and this dip is at 4000 Hz in AC/BC beta. We already done it. In noise-induced hearing loss, we see the dip called acoustic dip, and this dip at 4000 Hz in AC and BC. So, two questions here, beta. Noise-induced, question number 1, question number 2. Let us revise, beta. Noise-induced hearing loss, how much noise is allowed in industry nowadays? 85 decibel, 8 hours a day, 5 days a week. But if 85 is not mentioned in the choice, then the second best answer will be 90 decibel. This hearing loss has got a special dip, acoustic dip, which is at 4000 Hz in AC/BC both. Dip at 4000 Hz in AC/BC is called acoustic dip, and that's a feature of noise-induced hearing loss. Okay, fine. Now, the next question. Ototoxicity. Ototoxicity, beta. It is drug-induced hearing loss, beta. Drug-induced hearing loss. Ototoxicity is drug-induced hearing loss, beta. Okay, drug-induced hearing loss. Okay. Now, it's a pharmacology question. List of ototoxic drugs. Number 1, everybody read with me. Number 1, aminoglycoside. Aminoglycoside. For example, amikacin, streptomycin, and gentamicin. Aminoglycosides, number 1, amikacin, streptomycin, gentamicin, beta. You know, they are the major culprit is aminoglycoside. Okay. Number 2, loop diuretic, beta. Loop diuretic, furosemide, you know, furosemide Lasix, beta, very commonly used. Then anti-malarial, chloroquine and quinine. Chloroquine and quinine, beta. Then painkiller, NSAIDs, aspirin, ibuprofen and indomethacin, beta. Aspirin, ibuprofen and indomethacin, beta. Indomethacin. Aspirin, ibuprofen and indomethacin. Anti-cancer, cisplatin, carboplatin. And lastly, some miscellaneous drugs like desferoxamine, vancomycin, erythromycin. Desferoxamine, vancomycin, erythromycin. Let us revise once again. Drug-induced hearing loss or toxicity. Number 1, aminoglycoside, the champion, number 1 drug. Streptomycin, gentamicin, amikacin. Number 2, loop diuretic like furosemide. Anti-malarial like quinine, chloroquine. NSAIDs, painkiller like aspirin, ibuprofen, indomethacin. Anti-cancer drug like cisplatin, carboplatin. Desferoxamine, vancomycin, erythromycin. Now, ototoxicity shows high frequency SNHL in early stages. I told you the 250, 500 is low frequency, 6000, 8000 is high frequency. So drugs damage high frequency hearing loss in early stages. Ototoxicity shows high frequency SNHL in early stages. Therefore, high frequency audiometry, underline the word, high frequency audiometry is a special test used to diagnose ototoxicity. Ototoxicity shows high frequency SNHL in early stages. Therefore, high frequency audiometry is a special test used to diagnose ototoxicity. Okay, bache? What is the name of test? High frequency audiometry. It's a special test used to diagnose ototoxicity. Beta. Just write one line over here, beta. Noise, age, and drugs. They damage basal turn of cochlea first. They damage basal turn of cochlea first. Therefore, they cause high frequency SNHL in early stages. High frequency SNHL in early stages. Beta. Noise, age and drugs, they damage basal turn of cochlea first. Therefore, they cause high frequency SNHL in early stages. I repeat, noise, age and drugs, they damage basal turn of cochlea first. Therefore, they cause high frequency SNHL in early stages. Beta. Everybody, I would say, if you go back to your inner ear, beta, inner ear, everybody, just go to page number 113. 113, beta. Please see, 113, basal turn of cochlea. Everybody go to page number 113, beta, 113. Page number 113. Page number 113, do you remember? Basal turn of cochlea senses high frequency sound, apex senses low frequency sound, and that's why noise, age and drugs, they damage basal turn of cochlea first. Therefore, they cause high frequency SNHL in early stages. Beta. Okay, bache. Now go back and write there, beta. Write the page number 113, beta. This is the way I want, my dear friends, you to do revision, beta. Everybody, just write on the side, page 113, beta. Correlation is very important. Active revision, not just passively. Not passively. Page 113, beta. Page 113. Oh, I'll go page 113. I say, oh, yes, basal turn of cochlea is for high frequencies. That's why noise, age, and drugs damage basal turn of cochlea first, beta. Okay, bache. Fine. Okay. Now, everybody, now everyone, now please hear me carefully. Now, number one, we end the day here. I know you have another class. Relax for some time. And we'll have another session of 2 hours. If you just see here, what we are left with is around 10 pages. But believe me, this is the most important part of year actually. I don't want to do it at the end of the day. I think we'll have another day. I'll come again for maybe 2 hour session and we do all these topics. 4 topics left out of disease, beta. otosclerosis, acoustineuroma, glomus jugulare tumor, and Meniere's disease. Then we do facial nerve, some topics, and at the end we do cochlear implant and the brainstem implant. It will be one session without break of 2 hours, and let me see where we can put it. But I don't want to do at the end of the day. I want to have another meeting between two of us, so that we have another day to interact. I know I don't want to stretch it too much. This much, please revise, beta. Please revise. Whenever you get time, I know it's taxing for you. I know I can totally relate to what you're going through, but that's the way this structure is, beta. Go a bit more aggressive, beta. Don't be very quiet, silent, very inhibited kind of person, very slow. I know we are actually tired. I'm not saying that. I'm not undermining your efforts, beta. It's a huge effort on your part to really, get charged up at the end of the day again, to really start studying now. But then at special moments in a life, we're expected to do little more extra bit. And this is your time to do more extra. So please do not sort of feel that only you are doing it. All the people who passed before us, they also did the same. All the people who are with us in the batch also doing the same, beta. All across India, in Delhi, everywhere, beta. So each one of you, I would request that don't complain and crib too much, which is genuine complaint. I'm not saying that. But let us try to find reasons and excuses and ways and means to study as much as possible. Some revision is better than no revision, beta. You know it. Some revision is better than no revision. Okay? So even if it is not 100% of ear revision today or surgery revision today, tonight, at least let's revise first 30, 40 pages, maybe 20 pages, maybe 25 pages. But let us not declare the day very early over. Take a bath. Try this trick, believe me, it works. Take a bath and start the day afresh. This really works, only thing is you have to eat less after the bath. Eat little bit less, then take coffee after 1.5 hour tea. Then you eat the remaining part of your food again little bit, and then again study and then sleep better. Try to decrease the quota sleep gradually down better. Okay. I'm truly, can feel that you are with me in the same room. I hope you also can feel that I'm with you in the same room. I'm looking forward to the next session of ENT, the last part of the year, which will be scheduling at the earliest possible. Let me see in this weekend, or maybe I'll see where we can fit that, and we will be updated about it. It will be 2-hour session, and that will summarize the remaining part. Okay? But before that, may I request all of you to read this much year, beta. Year revise kar lena, beta. Before you do this, start this thing, on that day, please make sure that you get up early or sleep late and revise year before you come for this class, beta. Okay? Because these 10 pages would be really, very high yield for you otherwise. Okay? Thank you very much. Keep preparing. Keep the momentum intact and keep the hope alive, beta. I know you are tired. I know you're exhausted. But let us stretch ourselves. Let us look for, help from other people. Let us look at people for inspiration. If they can do, we can also do. Okay? Thank you very much. See you soon again for the last part of the year. Bye-bye. Take care. Take rest for some time before surgery starts.